Hi, good morning. I'm Dr. Ann Zink and providing our daily update on what's happening for Alaska and preparedness for COVID-19. As of this morning, March 6th, we have no confirmed cases in Alaska. We'll continue to update our website around noon every day to show the number of people we've tested, and we'll make sure that we get presumptive positives out if we happen to have a case in the state of Alaska. Today I want to talk a little bit about what to do to be prepared. We've been talking a lot about this, and a question I get all the time is, well, Anne, how are you changing your life? What has happened? So I thought I'd give you a few specifics on what I'm doing on a daily basis to make sure that I'm protecting myself, my family, my loved ones. So I'm making sure I'm washing my hands for 20 seconds every time I walk into the building, out of the building, using the restroom before I eat. I'm not wearing my rings anymore so that I can get good hand washing. I'm making sure that I involve my thumbs. I'm making sure that I pause before I go in and out of places and making sure I'm wiping down handles. I carry hand sanitizer as well as wipes with me on a regular basis. I'm not shaking hands anymore. I'm bumping elbows, saying hello, and making sure that I'm covering my mouth if I sneeze or cough and cleaning the area immediately afterwards. Every time I get in my car, I wipe off my car and other used handle spots. I'm encouraging my kids to do the same thing at school, washing off their computers, their hands, their lockers when they're going in and out of school to make sure that they're prepared. There's a lot that we can do to help decrease the transmission from droplet particles. That would include flu, but also includes this novel coronavirus. The other message that I really want to get out today is that as we continue to see spread across the United States, it's going to be more and more likely that people in Alaska may know people who had the novel coronavirus and or be asked to be quarantined at home. There's no way for us to track and trace every single person who may have been exposed individually as a state. And so what we're asking is you get notice that you have been exposed. Say you were on a cruise ship with someone else who had it. Say that you were on a flight and someone else had it, and you get notified from the airline that you follow those recommendations. If it asks you to stay home and quarantine for 14 days, you follow that. If you had close contact with someone who's been diagnosed with this novel coronavirus, that you also stay at home for those 14 days. Up on our website at DHSS, the Department of Health and Social Services, under coronavirus.alaska.gov, you can find care guidelines where we will link things that you can be checking for at home if you've been asked to be quarantined. So, everyone in Alaska, thank you for being there, being stronger together, and realizing that what you do really does make a difference. We appreciate everyone's time and attention to detail, and we'll talk to you soon. Thank you.